The CDC's director, Dr. Tom Frieden, briefed President Obama about the infection by phone yesterday. This morning, Dr. Frieden is with us from Atlanta. Good morning.
Good morning.
How will you find out whether this person transferred this to someone else, and how will you find out who those people are?
The bottom line is we're stopping this in its tracks in the U.S., and I'm confident we can do that because of our strong healthcare infection control and our strong public health system. What we do in public health day in and day out to protect Americans is something called contact tracing. We identify everyone who could have been in touch with the person when they were infectious, and then we monitor each of those people every day for 21 days. If they develop a fever or other symptoms, they get isolated. By doing that, we stop the chain of transmission from continuing. So that's the tried and true public health measure that will contain this case from spreading widely.
Does that include people who might have been on the plane?
That's a natural question, and it's one we get more than anything else. But let's just step back for a minute and understand what the reality is here. The bottom line is this man was not infectious when he got on the plane. We've checked 100% of the people leaving Liberia for fever. He didn't have fever. Anyone with fever is not allowed to board the plane. He didn't develop his first symptom till at least 4 days after he arrived in this country. The incubation period from exposure to infection can be as much as 21 days. So for those 4 days and the days he was on the plane, he could not have infected anyone.
But he did have symptoms for at least 4 days before he was isolated. How many people did he come in contact with?
That's exactly what we're in Dallas to find out. We know so far that he had several people in his household. They'll certainly be monitored to see if they develop fever. There may have been several other people in the community, and we'll go through every minute of each day with his family to understand who might have been exposed and every healthcare interaction he had to see if they're health workers who might have been exposed.
Dr. Frieden, when Americans hear this, that Ebola has reached America, they're scared and worried. What can you tell them and convince people that this will not spread?
We know how to stop Ebola. We will do it here. The challenge we have is not so much this case, although it's going to take a lot of work and a few weeks of really intensive monitoring, and there could be another case or two arising from the people who had contact with him in those 4 days, particularly potentially family members or others who had close exposures. But really, the bigger picture is this is a reflection of an epidemic in West Africa. And we have surged to respond to that epidemic, but stopping it at the source is the single most effective way to protect Americans.
Dr. Frieden, thank you so much.
Thank you.